Welcome back to Why We Nurse. We are on season 2, and I can't be more excited to be here with you guys. I do have a special episode for you guys today, and it is called Enough is Enough: Confronting Violence Against Texas Nurses. Disclaimer: this episode contains discussion of workplace violence. Please listen with care. Over the last year, Texas nurses have been saying the quiet part out loud. Violence is not part of the job, and we refuse to normalize it. New statewide survey results show 3 out of 4 Texas nurses experienced workplace violence in the past year, mostly verbal abuse, but far too often physical assaults and even sexual harassment. We'll unpack what's behind those numbers, how the new Texas law SB 240 is changing the landscape, and what hospitals are doing right now to prevent harm. And I'll share my reflections from my Nurse Manifest article, Enough is Enough: Taking Action to End Violence Against Nurses, about the moment many of us decided we're done carrying this alone. Healthcare has become like factory work. Staffing challenges, sicker patients, and less resources have stretched healthcare's limits. Expectations of family and patients are high, leaving healthcare workers unable to meet their demands. Being able to manage the workload simply isn't enough. Let's start with the statewide picture. In February 2025, the Texas Department of State Health Services released the 2024 Workplace Violence Against Nurses Individual Survey. 75.2% of respondents reported experiencing workplace violence in the past 12 months. 87.9% have experienced at least one type of violence over their career. The highest risk settings: correctional facilities at 87 facilities at 85.7%, and outpatient hospital units at 85. Most common perpetrator: patients with lack of respect for healthcare workers, insufficient staffing, and unrealistic expectations, ranking as top drivers. Nationally, recent survey work shows similar patterns. 81.6% of nurses experienced at least one type of workplace violence within the prior year, and nearly half saw rates increase, with many considering leaving the profession because employers aren't implementing effective prevention strategies. Texas responded with Senate Bill 240, effective September 1st, 2024. If you're working in a hospital, nursing facility, mental health facility, freestanding emergency department, or home health agency employing at least 2 RNs, your organization is now required to adopt a written workplace violence prevention plan and policy, establish a workplace violence prevention committee that includes at least one RN and one physician who provide direct care, plus a security representative, provide annual training and define reporting and response procedures, including post-incident support. Parallel to the law, Texas expanded grants to fund evidence-based prevention projects. Recent awardees include Guadalupe Regional Medical Center for tiered de-escalation training and mobile duress badges for rapid location-specific response, Memorial Hermann for specialized behavior management training for RNs serving patients with acquired brain injuries. Early updates show concrete progress with reductions in reported injuries and better tracking, from training completion to code green events. Statistics matter, but stories move leaders in communities. In San Antonio, an ICU nurse suffered a traumatic brain injury after a patient attack in July 2024. The incident reportedly wasn't properly reported to OSHA, and just days ago, in the Houston area, 3 nurses were allegedly assaulted, one of them pregnant, inside a hospital. I have been a nurse for over 20 years. In those years, I cannot recall a single year that went by without some form of assault. While mostly verbal, I have also experienced physical assault. In the course of providing care, I've been cursed at more times than I can even think. I've been told I'm stupid. I've been slapped, kicked, pinched. I have been grabbed to the point of having bruises on my arms, all for the sake of patient care. While my positive nursing experiences far outweigh the negative ones, I have found myself questioning if those were the reasons I left bedside nursing. Had it become too much for me? These are not isolated incidents. They reflect structural gaps, underreporting, insufficient staffing, training gaps, and inconsistent post-incident support. Let's look at what works. What actually reduces violence? Evidence and practice in Texas point to multi-layered approaches. De-escalation training that is scenario-based and refreshed annually, especially for high-risk units. Mobile duress badges and clear code protocols for rapid response. Behavior management tailored training to neuro rehab and mental health settings. Safe staffing. Research repeatedly links inadequate staffing to increased violence and burnout. Post-incident services, including immediate medical, psychological support and non-punitive reporting, as well as transparent follow-up. Nursing schools and health systems across Texas are integrating violence prevention into curricula and leadership training. We are also seeing DMP executive programs empower leaders to implement comprehensive policies and culture change. If you're a nurse, document every incident. Use your facility's reporting channels. Ask about your Senate Bill 240 committee and training plan. If you're a leader, audit your plan against Senate Bill 240. Fund duress technology, simulation training, and post-incident care. Track outcomes publicly. If you're a policymaker or advocate, support statewide transparency, staffing standards, and OSHA's forthcoming national standard. Enough is enough isn't a slogan, it's a standard. We will defend the dignity and safety of nurses because patient safety depends on ours. Violence against healthcare workers must end. It is dangerous not only to those providing care, patients are suffering. We are suffering. Thanks for listening to Why We Nurse. If today's episode resonates, share it with a colleague and leave us a review. Follow us on Facebook and Instagram at Why We Nurse for behind-the-scenes content and updates. Until next time, stay safe, stay bold, and remember why you nurse.